The healthcare profession, uh, can it thrive without marketing? Let me put this into this perspective. From there, they will start. Or what minimum thing that they should do to get into digital marketing? Hi, hello, welcome. Yet another new YouTube channel, Confidence Speaks. Okay, this channel is basically dedicated towards betterment of healthcare professionals. Healthcare professional means not only doctors, dentists, physiotherapists. So whatever you name, we want to make the lives of healthcare professional little better. Okay, by engaging in talks like we're over a coffee, how we are going to make improvement in everyday life of healthcare professionals. That is why we started this initiative. Confidence Speaks. Let's speak confidently with our guests, Mr. Harish.
Hello.
Hi, Harish.
Hi.
Welcome to the show.
Thank you. Thank you for having
I know Harish for a longer time, say 15 years. So our association goes back from Dr. Naidu's days.
Yes.
So that's where we met each other. And nice gentleman who is into digital marketing.
Yeah.
And exclusively for dentist and medical professions.
Healthcare profession.
So healthcare professions. I see healthcare profession, can it thrive without marketing? That's the first question that comes in my mind.
Okay. So let me put this into this perspective. First of all, thank you so much for taking me on the show. Okay. So the simple answer, can it thrive without healthcare, I mean digital marketing professionals? The simple answer is yes, it can thrive.
Is it?
Yeah.
Because tend to see that if I am not there in Google, patients are telling that I'm not at all existing.
Yes, but see, Google, everyone can go and everyone can go in and add their business in Google My Business. You don't need an agency as such to do this. It's a simple thing that you can do a small Google search and do it yourself. See,
So now the simplest thing which I need a straightforward answer is what are the components of digital marketing to start with? Okay, we are professions, we don't know what is this.
So when it comes to digital marketing basically has two verticals. Okay, one is running ads and bringing eyeballs to your respective channels or websites. Second thing is optimizing your whole channels and bringing in organic traffic. See, end of the day, digital marketing means bringing right eyeballs to your particular channels or your website. So this is what digital marketing is all about. See, when it comes to digital marketing agencies, we do both. One, we can also take a hospital or a clinic and we can also bring them more traffic via paying Google or Facebook, positioning in the right places and bringing right traffic to their website or their social media channels. On the other hand, we can also optimize it so that it organically ranks higher in Google, or we can also consistently start putting videos, optimizing the social media channels so that it gets very good eyeballs and then generate a lot of traffic.
Lot of technical words. Okay, unfortunately, I don't know how many of my colleagues will be able to follow. So let's make the life
Simple, much more simple.
Yeah.
More simpler. Okay.
My straightforward question is a new practice.
Okay.
They don't have any thing to spend for the agency.
Not an issue. Not
From there, they will start. What minimum thing that they should do to get into digital marketing?
Okay. So the minimum thing that they need to do in digital marketing is, first of all, they need to get themselves listed in Google My Business. Getting listed in Google My Business is very, very easy. All they need to do is search for Google My Business, just log in with their Gmail ID. They can then fill in all the details, and they need to also mention their categories. Mentioning the categories in Google My Business is very, very important. Once they do that,
One should be the category. Suppose if I'm,
for example, if you're a dentist, I would say dentist, dental clinic, dental implant specialist or prosthodontist. You can basically try with multiple keywords inside the categories and add more as much details inside the Google My Business page as much as possible. Then also make sure you get the review link. Okay. The review link is very important. I'll tell you what is the importance of the review link in the later. Then once the Google My Business page is finished, then you need to start yourself a social media channels. Instagram.
What are all the social media?
Okay. There are a lot of social media channels.
Mm.
One is Instagram. Second one is Facebook. Third is YouTube. There is something called as a LinkedIn and X. These are 5 social media channels. I'll also include Google My Business also as a social media channel where you put all the contents in all these places.
That means you mean to say that I should invest a lot of time in getting up, see, a particular post.
Okay.
In all the 6 at the same time.
Okay.
Is that what you're saying?
Yes, that's what I'm saying. So if you consistently build each and every vertical will have a different set of audiences. So if you consistently build content all these channels, it will definitely add values. Definitely you need to spend time on it because you are a startup clinic. You don't have you don't have the resources to hire a new clinic.
My question is also towards that point of opinion who has a lot of time.
Yeah.
So now let's move into you are very precise in your answer. I really appreciate it.
Okay.
Now let us move into a person who has started his practice early in the career. Okay. Bit of both. That is, he has little bit of money, a little bit of time. Now, what should be the strategy for?
Okay. So yes, a bit of a money and bit of a strategy. So what I would say depends on which particular vertical he is. For example, I'm taking as dentistry. So if it's a dentist who wants to, has a bit of a money to start, then he can
less than 10,000 or 5,000.
I'd say less than somewhere close to 15,000 rupees. So then he can go and hire a small agency. Okay. That agency, what he can do is he can ask them to maintain these contents, whatever contents that he is giving. We can bring in the consistency with the help of that particular agency.
It means posting the content
consistently.
There the next question comes. Yeah, okay. You are helping them or the agency helps them to post the content. Not only the content coming from.
Okay. The content definitely needs to come from the practitioner. Okay. Yes. See, digital marketing is not a one-sided work. Even if you hire an agency, you can't just hire an agency and leave it to that and they'll take care of everything. Doesn't work like that.
No, most of my colleagues,
they
all ask me, if I pay, can I get the content?
Yeah.
Because I don't have time. Is it that?
No, it doesn't work like that. Because I also say, when very classic same thing, I don't have the time, right? So, when I go to my kids' parents teachers meeting, the headmistress always says that if you don't have time to your children, why are you basically earning money? So that's the whole thing which I'm going to question here as well. See, if you don't have time for your business, this is your business. This is basically your living. So you are basically showing yourself to your other patients. So you need to definitely spend some amount of time trying to give whatever you're doing in terms of pictures or in terms of preventive videos or a lot of common FAQs videos. These videos need to be shot and needs to be posted on the social media channels to get more eyeballs. One, it will also definitely help the patients. Second, it will also help to get more audience to you.
No, my next question is as simple as that. You are saying you need to create a content.
Yes.
You need to record a video.
Yes.
Some of my people are very, very lethargic. They can't speak in front of a camera. Okay. And they have some reservation about how do they get into a conversation. See, they are very good in speaking to the patients. But when it comes to public speaking or speaking in front of the camera, they are not that very good. What you would suggest that?
See, for them,
having some clients like that.
Yeah, I definitely have a lot of clients like that. So what I would suggest them is, first of all, see, I would ask all my clients, okay, when it comes to any healthcare, we need to take testimonials or before and after pictures. Okay. So the before and after pictures or testimonials for in case of any other vertical, what was the patient going through before he is coming to him, after coming to him, there should be some sort of record.
You don't want them to talk.
No, you can see if this we are basically talking to them because they don't like to talk in front of the camera. So that's why we are giving them separate this kind of options. Or else the first option is always talking in front of the camera because in the current age, as an entrepreneurs, as clinics, doctors, everyone are pushed to become a content creators.
Is it?
Yes. So everyone are pushed to become content creators, to give some sort of content to the market, because especially in the B2C sector, wherever we basically see the end customers, those sectors, we definitely need to, become content
To
creators.
become a content
Content
creator.
creator, yes.
Now, that brings up to the third point.
Yeah.
That is, see, we saw people who doesn't have money,
Yeah.
lot of time.
Yeah.
We saw people who has little bit of money, little bit of time.
Yeah.
Now, I have another category.
Yeah.
A super specialist.
Okay.
High in the growth.
Yeah.
But the fear of missing out is there.
Yeah.
Stuck with
Yeah.
him.
Yeah.
So, he also wants to start something onto the digital marketing.
Okay.
Zero time. Okay, already answered that. Now they are ready with the money. What will be the suggestion for you?
See, I'll give you two suggestions. One is definitely we need to ask him to spend more time on giving us content, or if it doesn't allow us to do the content thing, then we need to hire a person who's 24/7 with them,
A dentist.
or is whoever it is,
Huh.
who can basically get content from him in his behalf.
So understand people. So if you don't have time, you have lot of money. Agency cannot do many things. So what you're saying is hire somebody apart from the agency.
Yes.
Hire somebody who
Who's going to give the content to the agency. See, if you don't have time to give the content, you need to have someone who can basically generate the content.
dentist who can communicate in between you and the super busy man.
Exactly. Not only a dentist, it can be a clinic receptionist or clinic or an assistant who can basically get all this content and give it to them. See, the content that we are asking is say we can start with before and after pictures. Then we can also ask testimonials from patients. We can
Those are all most of the people are doing now.
Yeah.
Anything super idea, one idea which you want to give to our listeners.
See, the lot of ideas, but
One idea.
the one, I won't say idea. The one thing that the doctor needs to do is consistency.
You simply amazing.
So the consistency, if you give a lot of consistent content, eventually you will start doing very good on digital.
Let's take a quick fire. Okay. Now, paid ad, consistency. Which one we choose?
I would choose consistency.
Okay.
I see, because I'll tell you why.
It's a rapid fire.
Yes.
Let's stop.
Okay, fine.
The next rapid fire question is person who has a lot of money, no time. Person who has a lot of time, no money. Which one you choose?
So I'll definitely choose the person who has not, when I say time, even if he has time, I'll choose who is going to give us more content to me. So yeah, who is going to much more be cooperative with the agency.
See, man, they want money. Understand?
So see, if he's very consistent, we can also give them, consultations, and we can tell them, do this consistently, do this, do regularly post blogs on your website, regularly do give a lot of value add to your existing patients. Ask them to ask them to come for recurring visits. All those things, if we give them consultations, I'm sure they can add more value.
Okay. Now, the final thing to go with. Now, can I run an ad and get more number of patients?
Depends who's running that. It depends who's running that. See, if you are if you yourself go and run all these ads in either in Google or Facebook, see all these companies are again they are also want money, right? So they will make it very easy for for a startup to run an ad. Okay, will it be efficient? It will be a $1,000 question mark. So if you want to run an ad efficiently, if you want to run ad to get much more better patients, you need to hire a very good agency who has experience in running these ads.
Because I can see a lot of ads in my own page.
Yeah.
Pay this much, and you can get your clients. Is that happening?
90% doesn't happen like that.
Okay.
In social, yeah. You see, I would say when you say paid ads, I see two difference.
Hmm.
If you run paid ads in social media, you are showing your options to people who needs the treatment or who does not need the treatment. So over that, the number of people converting into potential patients for you are much more lesser when you compare to the number of people converting to potential patients in Google Ads.
Okay. That brings up to the final question. The one thing which I wanted to know is how long it generally takes for a successful digital marketing campaign.
Organic campaign,
Yeah.
minimum 6 to 1 year. 6 to 1 year. Because if the competition is higher, it needs more time. More time and consistency is more important.
See, suppose for an example, I wanted to start a aligner ad.
Hmm.
How long it takes for me to get good number of aligner patients, traffic into my
Okay, so again, you're right now talking about the ads. So when it comes to ads, you
or
can
campaign, whatever it is.
yeah. See, there is a difference between running an ad and organically bringing traffic.
Right.
Organically bringing traffic, it takes time.
Hmm.
Running an ad, basically we are paying to these social media channels and Google to bring in
That's
those
what you
traffic.
told by
Yeah,
putting up only.
So on that you can once everything is set up, you can expect your patients coming in or inquiries coming in less than a month or maximum 45 days you will see at a
Okay, that's actually a lot of time. People needs to be more patient for your thing.
definitely needs to be patient. You can't you're if you start a clinic and you are expecting the clinic to run very good in the first day, doesn't happen that way.
Yeah, I can understand.
It doesn't happen that way.
So that's a wonderful discussion.
Thank you.
So the final thing that I can conclude by listening to you is,
Yeah.
number one is consistency.
Yes.
The second thing what you told now is
The second one, what I told you right now is you need to spend enough time and you need to give enough
Content.
time for the
Become a
content
content
creator. Yeah.
that's a watchword for me.
Yes.
So anybody, health professionals watching this, understand you need to be consistent, number one. Second one, we need to be a content creator. That's it from us. Let's make life little better. That's what the confidence can speaks to you. Like, share, and subscribe our channel. Confidence speaks. By the way, this is where we are signing off, confidently speaking to each other to make the life better for healthcare professionals. Hope this helps.
Hi guys, thank you so much for watching. Hope you like the video. I want you guys to like, share, and subscribe for our YouTube channel, Confidence Speaks. Thank you so much.